It's always a pleasure to host you. This is All in the Family. I'm your host, Mike Gitonga. 1 in 4 people attending a health facility in Kenya suffer from at least one mental disorder, together with a physical illness. According to some recent studies, still mental illness is widely misunderstood and stigmatized in Kenya. Dr. Mutisya, the chairperson of the Kenya Psychiatrist Association, calls on people to come together and fight this stigma. He was speaking at the open day at Mathare Hospital as the world celebrated this week World Mental Health Day.
As the world celebrates World Mental Health Day, this month, Mathare Hospital, which is the oldest referral hospital in Kenya, organized an open day to meet the stakeholders and relatives of the patients themed Depression, a Global Crisis.
Stop drug abuse, stop alcoholism, avoid drinking, kunywa dawa vizuri, pamoja tuangamize depression.
There are studies which have shown that 1 in 4 people attending a health facility in Kenya suffer from at least one mental disorder that coexists with the physical illness.
And the saddest thing was that a majority of that was going unnoticed. So that shows that there is a lot of mental illnesses in the society which is actually not diagnosed.
Mental illness is still widely misunderstood and stigmatized in Kenya, with many people believing that mentally ill people are only the dirty ones collecting rubbish on the streets and violent.
The kind of patients that we see here are patients who, although they have been considered as aggressive, violent people, that is not the reality. They are people with disorders, and most of them are calm people. All that they require is a treatment.
Taking depression as a global crisis, Dr. Mutisya, who was the chief guest, says that people should come together to fight out this stigma in our society.
So provision at the primary level, at the health level, at the community level, this is important.
In addition to that, Dr. Siengo had a different approach to the issue.
The society needs to be educated through the media, through all forms of talks, to understand how mental illness starts, how it can be treated, and how the mentally sick can get support, can get social support, and get support from other people.
As the government tries to enhance mental health awareness within the country and beyond by providing medical care, correct information, by empowering persons with mental disorders and their caregivers to find their voice and advocate for their rights, there is need for more funding to cater for the situation.
In future, we advocate for the government to allocate more funds into the Ministry of Medical Services and in particular mental health.
Enough is enough. Fanya hesabu.